So there's a whole range of different methods being used to try and look at how we optimise the use of medicines. And that's everything from the choice of medicines, stopping and starting medicines, helping patients understand how to take their medicines. But underpinning all of this, we need to understand what is happening, because at the moment there's 136 different acute trusts all doing something different, and we don't have the data and the intelligence and the information to support understanding how we help patients best take their medicines. And we've heard about challenges with getting information between community pharmacies, hospital pharmacies, back to GPs. It's really about how we get that information flowing so that the patient is part of that medicines optimisation and they take the medicines rather than wasting them. It's interesting because you can get lost in the specialist knowledge about understanding what the drugs are and things like that, but what we've got to help is execs, chief execs and others within trusts to understand that this is a £15.2 billion spend nationally on medicines, 7.6 billion in hospitals, and we've got to help them understand that that data is key to how we create some headroom so that we can use all of the new medicines that are coming along that are very expensive. We have to change behaviours, and I work with Lord Carter looking at how we help and encourage organisations to change behaviour. One of the key drivers is information and being able to see and compare. And there's a bit of gamification, if you like, in as much as trusts don't want to be worse than somebody that they always think they're better than, and they want to be able to look at the data. And medicines is exactly the same as hip revisions, knee problems, infection rates. It's trying to help them understand, and there's those little nuggets that you have to get into that executive level understanding so that they can take on the digital infrastructure that will help in the background. It's not in the main, it's not something front and centre, it's in the background that helps enable a lot of the stuff that we're doing. An interoperable system that works across the peaks. So it's about ordering, invoicing, prescribing, ordering, getting it from a hub and spoke, so you might be outsourced your supply and being delivered from, say, Salicio in Warrington, being able to then get communication out to the GPs, out to the community pharmacies, and information back again, because we have lots of patients who are on very complex medicines who are getting their supplies from the hospital, but they see their community pharmacy twice a week. And the community pharmacy does things, but they don't necessarily know what the complex medicines are. So it's about changing that approach and looking at the patient's journey, not the hospital box that says we're doing hospital pharmacy, the GP that says we're doing GPs, and then the community pharmacy which is saying we're doing community pharmacy stuff. We want to get it around the patient. So the digital infrastructure is how you can take that forward.